Hello everyone, it's Angelika Kargulewicz, clinical nutritionist, and today we will talk about one of the oldest fermented food product. It was known for thousands of years since the Hippocratic era, and it was used as far back as antiquity, as a condiment, but also as a preservative and also as a refreshing drink. What is about? Today we will talk about apple cider vinegar, and it was already used in folk medicine, for example, to treat infections. And it is true because apple cider vinegar neutralizes the pathogenic bacteria in the digestive tract and also is used to treat, for example, urinary tract infections. In traditional medicine, apple cider vinegar was also beneficial in the course of the gout because it relieves or even eliminates the symptoms, but also beneficial when it comes to rheumatoid arthritis, also to regulate lipid profile and strengthen the walls of the blood cells, but also to eliminate and to minimize the adipose tissue. Moreover, the apple cider vinegar has also a positive effect on the physical condition and strengthens the immune system. And its application can be also culinary because it acidifies the flavor of the food and can be used as an ingredient in the dressings, for example for the salad, but also as an ingredient in ketchup or mustard. And how is apple cider vinegar produced? So it is produced as a result of the anaerobic alcoholic fermentation of fruit using yeast, followed by acetic acid biosynthesis, which is carried out using aerobic acetic acid bacteria. And the main metabolite produced by these bacteria is acetic acid. Apple cider vinegar also contains formic acid, succinic acid, tartaric acid, but also malic acid, citric and lactic acid, and in trace amounts amino acids, vitamins, minerals, and also phenolic compounds, like for example catechins, ferulic acid and caffeic acid. And more contemporary research findings show that apple cider vinegar stabilizes glycemia, lipid profile and also inhibits microbial growth. Acetic acid contained in apple cider vinegar is responsible for the hypoglycemic effect, and the potential mechanism for this action is delayed gastric emptying or reduced amylase activity. And in one study it was shown that 2 tablespoons, around 28 grams of apple cider vinegar taken before a meal containing around 50 grams of starchy carbohydrates reduced the post-meal glucose and insulin levels by 20% in healthy individuals. Such an effect is mainly observed for complex carbohydrates because in the study with a meal containing simple carbohydrates, no such a relationship was observed. And also another study shows that the addition of the vinegared sauce to the cooked potatoes has a lowering effect on postprandial glucose and insulin levels in healthy individuals. 30 milliliters of apple cider vinegar daily for 8 weeks can also lower the glycated hemoglobin level, but note that a large number of people drop out during the study. And it is worth to mention that better effect is seen when vinegar is given immediately before the meal than, for example, 5 hours before the meal. And for a hypoglycemic effect, only 10 grams of apple cider vinegar is sufficient. And what about the use of apple cider vinegar in people with insulin resistance and type 2 diabetes? So, the supply of apple cider vinegar in insulin resistant people before a high carbohydrate meal reduces the postprandial glucose and insulin levels, but also increases the insulin sensitivity by up to 34%. But unfortunately, less satisfactory results are seen in type 2 diabetes, and the conclusion can be that apple cider vinegar has a better effect in people with moderate insulin resistance and preserved insulin secretion by the pancreas. And another interesting fact is that in people with carbohydrate metabolic disorders, the supply of the apple cider vinegar before the bedtime results in lower fasting glucose levels the next day. And also more research findings from 2021 systematic review and meta-analysis give the confirmation of the beneficial effect of the apple cider vinegar on lipid and glucose metabolism in humans. But we also should take into consideration that sometimes apple cider vinegar can be dangerous. For example, there exists a risk of hypoglycemia, especially in insulin users, but also in people with so-called gastroparesis. Apple cider vinegar can also be helpful in the weight reduction, and it was shown that apple cider vinegar influenced the feeling of the satiety, and it was shown that the intake of the apple cider vinegar results in the lower calories intake by around 200 to 275 kilocalories within 24 hours. And let's remember that apple cider vinegar can also influence lipid profile. It was shown that 15 to 30 milliliters of apple cider vinegar per day in obese patients for 12 weeks resulted in the reduction of the triglycerides levels as soon as the week 4 of the use. We should also be aware that this effect on the triglycerides can also be explained by the influence of the apple cider vinegar on the weight loss of these individuals. But other human studies show that apple cider vinegar can also cause the decrease in low density lipoproteins, which means LDL. But we should also be aware of the fact that more studies are from animal models than from the human studies. And what about the influence of the apple cider vinegar on the reflux? It is a very interesting question. Can be helpful or, on the other hand, dangerous. So let's remember that acetic acid, which is the main active ingredient of the apple cider vinegar, in the concentrations greater than 20% is considered to be toxic. It can cause corrosive effect on the esophageal mucosa and so-called esophageal injury. Luckily, the commercial available vinegars typically present the concentration of the acetic acid of 4 to 7%. And when it comes to the potential beneficial effects of the apple cider vinegar on the reflux symptoms, it was one study in which the participants used a gum containing apple cider vinegar, but also licorice and papain, which is a proteolytic enzyme from the papaya. And they used this gum for the 2 weeks. After this time, the participants observed a subjective improvement in the reflux symptoms in comparison to those who chewed a placebo gum. Of course, it is difficult to say whether the apple cider vinegar is the very ingredient that improved the reflux symptoms, and of course, throwing a gum is other than a popular supply of the apple cider vinegar. When it comes to the possible side effects of the apple cider vinegar, we can find the information about the decrease in the urine pH, also increase in the liver enzyme, and some cases of the mucosal inflammation. Safety of use is usually 90 milliliters of apple cider vinegar, which is an equivalent of 4,500 milligrams of acetic acid per day for 4 weeks, has no adverse effects but in healthy people. And the moderate consumption of the commercial vinegar, more or less 2 tablespoons with each meal served as a dressing, is rather safe. And in my opinion, the best way to serve apple cider vinegar is to green leafy vegetables with the apple cider vinegar dressing before the main course. In conclusion, as you can see, apple cider vinegar, known from the ancient times, can be also very useful nowadays. For example, to regulate glucose metabolism, lipid profile, and for example to help, but in a slight weight reduction. But if you suffer from any digestive disease like the inflammation of the mucosa, you should be aware of the fact that the apple cider vinegar can also stimulate the symptoms. If you liked my channel, please leave the thumb up, also subscribe the channel, leave the comment in the comment section, and see you soon in the next episode.